Hello, and welcome back to Nurses Notes 101. Today we will be talking about metabolic acidosis. So, due to this blood gas being acidotic, we are aware that the pH will be lower. And it seems like the source of this abnormality is a metabolic source. So, let's get into it. Metabolic acidosis occurs when there's too much acid buildup in the body. This is usually due to ineffective kidney clearance. Like I previously stated, the blood pH will be under 7.35 and the bicarb will be under 22, which are both the normal ranges. Some associated symptoms that could be related to this condition include diabetic ketoacidosis. Other causes of metabolic acidosis include severe diarrhea, shock, and renal failure. Side effects of metabolic acidosis include headache, decreased blood pressure, hyperkalemia, muscle twitching, warm flushed skin, nauseousness, vomiting, diarrhea, changes in level of consciousness, and Kussmaul's respirations. Just a little tidbit on Kussmaul's. So, Kussmaul's respirations is a compensatory mechanism in which the person who is having the metabolic acidosis starts breathing. I would say it's like pretty shallow breaths, but they're usually hyperventilating at this point. So at this point, they're trying to blow off all the excess acid. If the patient is in DKA, diabetic ketoacidosis, you might also be able to smell ketones on their breath, which smells somewhat fruity. To treat metabolic acidosis, if it is due to DKA, we're going to give insulin or diabetic medication. Also, because metabolic acidosis, the main affected organ is the kidney, we will usually give fluids to try and flush the kidney out and help the perfusion of the kidneys. And if we see that the kidneys are failing, we will give an electrolyte binder just to prevent hyperkalemia. But if we see that the patient is having massive amounts of diarrhea, a lot of vomiting, the patient can actually be losing electrolytes. So then at that point, we could give them electrolytes. Please hit the like button and subscribe to my channel. Thank you for listening, and I hope you learned something.